adults in Bedfordshire and Luton who have a learning disability and who are prescribed anti-psychotic medication without having a diagnosis, or those people who are at risk of being prescribed anti-psychotic medication without an underlying confirmed diagnosis. We're talking about people who have learning disabilities, who are in supportive services, whose behaviour is deemed as so challenging and difficult that they've been prescribed anti-psychotic medication to help with maybe a little bit more sedative approach and reducing the challenging and difficult behaviours.
We started thinking about, well, actually, anti-psychotic medication prescribing in this population, it's more of a sign that, well, something isn't working, and is it that the issues around the support around that person, or difficulties that person has with communicating.
One of the biggest challenges so far was we had to undertake what's known as a 3-part data review. And when that was put to us, my goodness, that probably scared the living daylights out of us. But we sat with our support and we drafted up the kind of information we needed, and then we drafted up what we were going to take from that information. So we know we needed to engage with professionals, carers, who are involved in delivering services for people who have LD. And we also knew that, and we felt quite passionate that we had to have conversations with some of our service users, because we needed to know what their views was, what their understanding was of this, what their views was, and what information they could bring to help us learn. So we had a really tight turnaround on this. We had about a week to get the information out, get it back in and collate it. And looking back, I'm not sure quite how we realistically managed it, but we did. And we did it by drawing in some key members of our own service, and we drafted up the questions and the surveys that we needed to use. We got some members of our team to take surveys out and give them allocated people to see. And we did an email drop, which seemed a much more appropriate way of getting out to professionals. So we had such a range of people that we sent these questionnaires to, and we had email responses, we had telephone engagement on consultations, we had some face-to-face meetings with people, mostly our service users.
So some of the questions were that we were asking our people with learning disabilities were things like, what kind of things motivate them? What are the things that they find interesting, and what helps them to keep well? And then thinking about, for them, how have things been when things haven't been so well? Who helped? Who didn't help? What went well? What could have gone better? And that was really helpful to try and understand from their perspective what's working well and what isn't. What do we need to focus on? And then from the staff and carers' point of view, we had a similar sort of theme to try and work out really what did they find the services were sort of helping them with, and where did they need more support with.
We were kind of inundated with the amount of information that came back. It was absolutely breathtaking, and in such a short time as well. It was like we'd opened a door or opened a floodgate for people to say, yes, let me tell you, I want to tell you about this, which was fabulous. So we sat down, we looked at what the core themes were from that, and we kind of drew out lots of common threads, and it was quite interesting because we could see where the different opinions and the different views were coming from. So we could see what the commissioners were thinking, we could see what local authority teams were thinking, we could see what carers and support workers in care provider organisations were thinking, and then we could see how some of our service users felt and what they felt with their challenges. And we were quite bowled over because, and this really lended itself to Triple Aim, because our starting point was anti-psychotic medication and the impact it has on people. But it became really apparent that it's not just anti-psychotic medication and the impact it has on people, it's how that's managed, it's what other support mechanisms are out there. And the other interesting part of that was, so some of the staff that were involved in conducting the interviews and conducting questionnaires came back and were blown away by the chance to talk to people about something that's not specific to their discipline. So, for example, we had a psychology assistant going out and talking to somebody about all of this and getting this information back when it's got nothing to do with a psychology assessment or behaviour support. It was genuinely asking what makes people tick, what's important to people, what would make things better, and it just spurred people on, which was fabulous for us as well as part of a team, because it really kind of gave some ownership to people working in the team as to there's much more to what we're doing than outside of our own area of work.
We've gathered some really amazing information from all these different people, from service users, from professionals, and we are in the process of sitting down, going over all that information and helping that to develop some themes which are starting to come through from the information that we've received. And we're going to use that to help us build our driver diagram from the ground up, really.